understand, less than 1% of the immune system. It's almost paradoxical. This is the system that's in charge of keeping us most healthy, and it's the thing that we are most struggling to assess.
Welcome to the Global Network for Science and Diplomacy podcast. Today, I'm happy to welcome Professor Shai Shen-Orr, whose work is reshaping how we understand the immune system, not as a collection of parts, but as a dynamic and measurable system.
So hi, Stephanie. Pleasure to be here.
You often describe the immune system as a kind of sensory system, almost like a sixth sense of the body. What does that perspective change in the way we understand health, not as a static state, but as a dynamic interaction with our environment?
I think this is one of my drivers. If you think about systems as being dynamic, it means you cannot stop looking at them to understand what they are. And in many ways, I think this is today, and we can talk about half glass full, half glass empty. But we have gone a long way in understanding the immune system, but there's so much more to do on the system that really is the most adapting in life. And if we're thinking about its implications from healthcare or all the way to understanding the world and an environment around us, this is the thing that we need to be looking at, and so the implication of a sixth sense is, hey, don't forget about this one.
What are the fundamental drivers of this variability, and what does it reveal about the limits of one-size-fits-all medicine?
The biggest driver, as relates to the sixth sense, is life history. Every encounter that you as a human being go through, and one could easily argue in utero as well, is going to be ultimately leaving a footprint on your immune system. And this is, and it's a good thing too, with respect of this is a system that needs to adapt. Its sole primary role is not defense. It is maintaining homeostasis of the body, maintaining a balancing, right? It could be in a disease, of course, or an infection, and we think about it easily, but it can be in many other contexts. So everything that happens, you're going to see some kind of a footprint there, as opposed to, say, the genome in that end. And so if I look at that, life history implication, that ultimately says, certainly for what we call immunotherapies, which are the biggest kind of growth market in terms of drugs, is that we need to be much more tailored as we do them, because people really look differently with respect to their immune system. And as I'm sure we'll get to, it's a non-trivial thing to get to that stage where we can deliver precise treatments in this.
You introduced the concept of immune age as a more accurate measure of health than a chronological age. If this concept becomes widely adopted, how could it fundamentally transform clinical practice, prevention, and even how we define aging itself?
Aging has a big merit in the sense of it's easy to ask you how old you are, and it's also easy to celebrate on a given day in the year, your birthday, right? Other than that, I would argue that there's a lot of limitations of using chronological aging as something in life, and it actually is a reflection of the diversity of humankind. In that, we ultimately age because of our experiences differently. Those experiences can be cognitive, but they can also be, getting exposed to a dose of pathogens or life, in general, viruses and illnesses and so forth. So what we have been showing is that immune aging with respect to the immune system, and the key, as you can imagine, you can see, I see everything from the view of the immune system. It is a fundamental thing to measure, because when it comes to anything related to diagnostics, treatments, and so forth, the right question to be asking, the physician should be asking, is not how old you are, right? But in fact, I would notice, and I often say, people would come to the hospital and say, how's my immune system doing? There's no good answer for this. But, if I'm thinking about will I be responding to this vaccine? Will this immunotherapy work for me? Will this drug work for me? What's the likelihood of developing a disease? All of those questions, what I want physicians to say is, let's do a deep dive on your immune system. And today we're not there yet.
What is missing today to truly bridge this data insight gap, and what breakthroughs are needed to make data clinical actionable at scale?
I would separate the two. One is what is needed in terms of the data insight gap. So to give our listeners an example, I think I would argue, data in biology and healthcare, but also in many other walks of life for the past 20 years has been growing exponentially. Not only are we able to store data that we used to not be able to store the information, but we have better and better technologies that collect information on us, now almost for many things continuously and in high resolution. So data is exploding. The question to ask yourself is, it costs money to measure these things. Are we getting value out of it? Are we getting enough value out of it? And even more important than this is, could we do better, right? So if data grows exponentially, I would argue that and we celebrate it. Oh, we have big data. I have more data than you have data. The right thing to ask is, what's the level of insight that I'm getting from it, and how much did bang for the buck, if you like, from the data to insight. And insight is actually equal to value, not the amount of data. It's the value that you get from insight. You can get a lot of insight from a small amount of data if you ask the right questions, and vice versa. You can have a lot of data and totally miss out on the insights. So the gap there is actually investing not in data, but actually in how we analyze the data. How do we bring insights out? AI has been a huge, tremendous leap there, and we sense it now in recent years with the LLMs, right? We're suddenly managing to get more out of text and world knowledge than we could before. But when it comes to not textual data and not kind of images and static data, genetics, the pathologies, text information, that's all static, right? If I start looking at dynamics, your immune system changing over time, your gene expression, a lot of different things. Most things in life change over time. And those that are complex, AI ain't doing so well yet. And it's actually tells us a bit about how we think about the future. It's the combination of thinking about bringing in sophisticated data science with understanding of domains. And the reason you need to understand the domains is because humans still have a role, and a significant role, to fill the gap, right? Machine learning is limited ultimately, and we have a lot of experience that allows us to deal with the fact that there's actually, in biology, is celebrating big data. We don't have that much deep data. It's mostly a lot more measurements than we did before. I do a big experiment in biology is 100 people that I measured 2 million things on, right? So if I think about this as an equation, I have a lot of, two variables, two equations type thing. Well, I have way too many variables to be able to solve this problem. The domain expertise helps.
Let's talk about the drug development and with AI, and specifically through cytoreason. So your work enables pharmaceutical companies to model the immune system and guide drug development. Are we moving toward a future where drug development becomes predictive rather than experimental? And what will that change in terms of cost, speed, and success rates?
So the short answer is absolutely yes. We are moving to a world that's more predictable, less what I would call trial and error, and it's going to be faster and so forth, right? But let's not oversell it in the sense of this is a long road. Biology, and this is where drugs work. They're in the world of biology, right? Ultimately, we give them, but they need to deal with the variation of things that we measure. And there is still more unknowns in biology than there are known things. And so when we give those drugs and we understand, you try to quantify success. So, the number that's often get quoted is it takes about $2.5 billion to develop a drug, and success rates, if you start counting from phase 1 across the board, sit at about 9%. There is evidence to suggest that we can do better. So, for instance, if we know there's a genetic mutation in the gene that the drug is aimed for, that is going to increase the likelihood of the drug being successful. Right? So what would AI help us to do? Well, I'm going to celebrate and moving of an average from 9% to 12%. But I'm not going to stop there. Then I want to see 15%, 18%, 20%. And I don't know how long it's going to take us. I don't think anybody does. I think when people say, we've solved it, it mostly reflects that they don't understand the complexity of the problem. But it's the positive road forward, and it's a necessity to get to precision medicine, right? Because otherwise, if drug development remains what people would call failure business, as a good friend of mine once said, then there's a problem of financials to actually do things at a tailored level if there's so much situations where we fail, right?
Right. Let's switch a little bit to system thinking. Immunology has traditionally been studied in a reductionist way, meaning one cell, one pathway at a time. What does a system-level understanding reveal that we were fundamentally missing before?
So I'll tell you, this relates also to your previous question is, so how do you move forward? How do you move 9% to 12% to 15%? So forth? And the answer is, well, start thinking differently about it. Bring in all the data. Let's look at the variation. Embrace the diversity is what I call it often. Bring in all the data. Look how variable it is between patients, different places in the world, what happens with people who smoke or don't smoke. Take all this information in. Admit that there's a lot of it that you don't understand, right? But start integrating through this and merge the value that kind of can come from the AI, right, of kind of analyzing the data with the value that comes from the existing domain knowledge, right? The two together allow us to start moving forward and kind of start shrinking the data insight gap by starting to accelerate the insight, how insight grows. And if I think about, and this really has to do with what we call systems biology, because rather than looking at one gene or kind of one pathway, we're looking at the entire network of interaction cells, learning, even though this is complex data, learning from one place how it can impact another. We should be targeting not a gene or a cell, but a system. As we understand the system, we can hit it better with therapeutics.
Your research tracks immune changes over time, not just snapshots. How does longitudinal data change your ability to understand disease from something we detect to something we can anticipate?
Here's my little equation. For every 1,000 people that you're willing to give me a single time point for, I am willing to take, 2 orders of magnitude less, but over time. And the reason, especially when we talk about the immune system, and the reason is because it's so complex biology, because we don't understand so much of it. Studying how one person changes over time cleans up a lot of noise, right? If each one of us has a different life history and each one of us looks different, and you gave me a single time point for each one of us, right? I'm trying to make sense of this. It's very difficult. If I take one person and I say, how does it look today? How does it look next week? And suddenly I understand what are the drivers of the system, and I can start making very clear mechanistic understandings that take me not beyond prediction to something that would be causal. And I think ultimately, if we think about how do we close the data insight gap, is moving to more and more causal mechanisms, right? And longitudinal data is the key for this.
Precision medicine has been a promise for years, and you talked about it previously in this interview. What are the key scientific and systemic barriers that still prevent us from fully delivering truly personalized immune-based medicine?
Wonderful question. I kind of hinted at it before. Just think about it this way: if I wanted to do precision medicine, it would need. It obviously means to the extreme. It means every person gets a different treatment, right? Obviously, it's an extreme. But if every person gives a different treatment, that means that if I need to manufacture this treatment, I need to know that I'm going to succeed, because if I don't succeed, then I spend a lot of money and I didn't help a person, right? So to be able to, from a drug development perspective, to be able to really get to precision medicine means that we need to move kind of to bigger success rates so people can take risks in an economic, fashionable way. If I think about this from a diagnostic perspective, which is that we can pick, at an individual level, what's the chance that you'll get a disease, what's the chance you respond to the drug, and so forth. There, the limitation is different. The limitation is, how do you get medicine from I would say, disease care to kind of healthcare, which is preventive. And for this, you need to change what personally I think are the slowest movers in the industry, which are the payers, the insurers, right? Until an insurance company is willing to measure something that's not in standard protocols and is proving to be bringing value, when we get to that point where they're quick to adopt new technologies, then we will get to preventive care. And for this, you need to build the right economic models, and you need to shorten cycles where, it takes today to develop a biomarker, almost as much as it takes to develop a drug, 15 years easily, right? You need to, if you want to celebrate, genomic medicine, precision medicine, and you're thinking that, it's the things from, 2010 that are making it to the market now, right? This needs to be kind of narrowed, kind of made shorter, and it's a must. And the reason it's a must is because the world is getting old, significantly older, right? The statistics are today is that 1 in 9 people globally is over the age of 65. Next year marks a landmark year where, for the first time in the world, there are more people over the age of 65 than children below the age of 10. And in 20 years, you're talking about 1 in 4 is over the age of 65. And as the rate we're going, in which people live longer but have disease, and disease is expensive, and we don't have the economic systems to support it, we got a problem. And that problem is going to require us to move to preventive care. I hope we are wise enough to do it, sooner rather than later, as they say.
Thank you so much for this. Let's just move from ethics to data. As we use more AI and deeper biological data, the ethical questions also becomes a little bit harder, especially across countries where privacy standards and data governance are very different. How should we think about these boundaries when we are modeling something as personal as someone's biology or aging trajectory, meaning in longitudinal data?
Real truth is, I don't have an answer because it's so complex. And as you said, it is so cultural. In some societies, the preference is, give me the data so I can make choices, and I'm willing to share my information. Give me the insight, so I'm willing to share my data so that I can make informed choices. In others, the data is very protected, and I don't want to give you the data because I'm afraid you'll do something bad with it, or you're not necessarily the person I gave it to, but it would leak and so forth. I don't have a good answer to this, except for education and fear of missing out on one hand, and on the other, so education and proof, right? So if you start seeing that actually sharing data improves your life, improves your healthcare, and so forth, then more people would share it, and guardrails are put in terms of it, right? If I'm looking at some of what's happening in social media, that's a negative effect. I share data, and I'm getting back something that probably is not of big benefit to me. I would like to hope, at least that's how I've chosen my own profession, that I'm in a situation where when I ask people for data, I bring them value back. And when more and more of that value becomes material, I think culture will change. And for those of not, it's personal choice, and we have to respect.
What needs to happen for breakthroughs in system immunology to inform policy and healthcare system at scale? And what role do international cooperation and scientific advisory networks play in that process?
Oh, wonderful question. So I will, I guess, disclose. So I'm the co-CSO of the Human Immunome Project, right, which is a global nonprofit. I kind of co-chair the CSO position with John Sang with Yale. And the goal of the Human Immunome Project is to ultimately build a database of human immune variation across the globe. And the reason we think this is important is because of, as I kind of highlighted multiple times in this discussion, basically understanding the immune system is integral to understanding healthcare and preventing disease. but it's the right time, and it's the right time because AI has brought us the ability to do something with this, and COVID has brought us the recognition across the globe that immunity matters, right? But what I think is also clear, and COVID is actually an interesting example of this as well, is that if you want to, as something matures, it needs to grow out of the lab and start drinking in more and more partners with different skill sets that can make an impact. Academics, have some things that they do amazingly well, and some things that, let's say they were not selected for. and to be able to, and they're not necessarily incentivized by their own personal motivations. So if I think about partnerships, and if I think about how do you really ultimately make impact, it requires a diverse group of people. It means that, in fact, if you think about immunology, it requires international cooperation, because, it's only by seeing the diversity that I understand what I'm all about. And for this, we've been forming within the Human Immunome Project, which we kind of call HIP, we've formed a scientific network of partners that are spread across the globe from the US to Nicaragua. And they're all about, it's one immune system that we all share with slight variation. We should be thinking about this as one ecosystem to study it.
We know that your work has clear implications beyond science for global health systems, international research and collaboration, and of course, data governance. But how can science diplomacy help ensure that advances in system immunology and AI are shared, governed, and applied responsibly across countries?
Ooh, that's a tough question. You need to think a lot about the ethics and the principles and the impact you want to achieve first. And you only bring in players that are willing to sign on to this manifest that you've created. And you have no control about what people will do outside of the scope of, but if you start the origin right and you've added people in with the right mindset, I think you can achieve the right responsible sharing, governance, and and variation that different cultures need on this information. So it's understanding that on one hand you need to be thinking global, on the other hand you have to understand that local people in different places have different cultures and have different agendas and incentives, and respecting that and giving the ability to work within this. And there's a lot of that's happening that's becoming, and I think this is a good thing. Countries are becoming stronger about data policy, about how they send data. There's more and more solutions that are what we would call federated solutions, or swarm learning is one of our partners, Joachim Schulze, is kind of developing. So it's really about, maybe I can send the algorithms and not the data. A lot of those things need to be put in place, understanding, again, that there's a diverse crowd, and that but ultimately we need to come in together to really bring the value out, but we need to respect individual variation.
Now let's move forward to the future of medicine. What will medicine look like in 10 to 20 years if your vision succeeds? And what role will the immune system play in that future? Knowing that we know now.
I put it forth many years ago, as guy walks into the doctor's office and says, "Hey doc, how's my immune system doing?" And it's been 15 years, I think, since I said it first. So now I've made significant progress, but I'm not still far away from her. So I would hope to say that in 10, 15 years or 20, I would be able to go to my physician, and not just me. I'm already doing this, but others, and say, "Hey doc, how's my immune system doing?" Or better, I'd say, how's my heart doing? How's my diabetes doing? How is my, what should I do about this treatment? And healthcare physicians would have good, strong tools to take the immune system into account, which is exactly what's missing today. It's almost paradoxical if you think about, this is the system that's in charge of keeping us most healthy, and sits at the center of disease, and it's the thing that we are most struggling to assess in high resolution. Every other system in the body, you need a a heart test. Oh, here go, do an EKG, and you want to say neuronal function. We'll put you in MRI. You want the immune system? Oh, we can do IgG and CBC. It's not even close to the complexity that's there, despite its central role in disease. And this is the vision I would hope to see. I think it's going to have an impact on the future of medicine in general. But in the same point I'll raise, in those 20 years, the world will grow older. And so a lot of things are going to change. If I had to give a tip to young people today who would ask me, and I do, and they ask me which field they should go into and so forth, actually, look at the demands of the world in 15, 20 years. Are they going to be in prompt engineering? I doubt it. Right? I think at that point, it's like I say today, I need to learn how to write with a pen. Of course, we need to learn how to write with a pen, but it's not where the world's going to be in 20 years. Right? Look at the big problems of the world. One of them is going to be that the population is going to be way older. This is not something that is disputable, right? It's not like some of us can argue, yes, there's climate change happening. No, there's not. The world will grow older. There's no way of turning it back, right? You can invest your future in this.
There's clearly evidence now.
Yeah.
So finally, on a more personal note, what continues to drive your curiosity and passion in a field as complex and ever-evolving as immunology?
It's a weird answer, but I'll tell you, I got into doing science studying E. coli. It was a cool system. I've always loved complex thinking and complex systems, and so it's always been systems biology. But the way I got to the immune system is that when I studied E. coli, it was great, but the impact to people was distant. So I moved to studying worms, and that were even more complex than E. coli. Anyway, but the impact was still distant. When you study the immune system, for me, I've found this, amazing juxtaposition of, on one hand, this is a complex system that you can study basic science of networks and evolution. The immune system genes are the fastest evolving in the genome. There's a huge amount that you can ask on that direction. On the other hand, as I think I've said now multiple times here, it's at the center of healthcare. Everything that you do, every cool idea that I have about studying something basic about the immune system has implications on humans' lives. And to me, that's a passion. And if I think of how much I understand of the immune system now, or we as humans understand, I think it's less than 1%. So there's so much more to do. And so in 10, 20 years, I'll still be having fun.
If you have one thing to leave with the next generation of scientists, what would it be?
I would say think ahead, because I would argue that there's a lot of passions. And in fact, a good trait of a scientist is that you can hook them and get them excited about a lot of different things, right? So let's assume there's very few things that bore you and a lot of things that you're passionate about. How do you choose where you focus? There, I think the strategy comes into play. Think about where the world is, what other people are doing, and try to differentiate yourself. Go into places where people are not there, and yet you can think about them and imagine the future where they become important. If you do that, you're likely to be one of those people that are actually going to make that future happen, because you chose as Robert Frost says, right, the road not taken. You chose the road not taken. Yeah, it was a bit lonely for a while. But then, if you made wise bets, you bet on something that's going to happen anyhow. You just happen to be traveling the road longer than most people. And so that's going to be a fun fun payback on a lot of real lonely time spent on the road.
Professor Shen-Orr, thank you so much for this inspiring conversation and for sharing such a powerful vision. It has been a real privilege to have you with us.
Thank you, Stefan. It's been a real pleasure. And thank you to the audience.
Yes. You've been listening to the Global Network for Science and Diplomacy podcast.